I am Emily Frank. I am from Messina, New York. I graduated from SUNY Canton in 2008 with my associate's degree in nursing, and then went on, had some family, and then went on for my family nurse practitioner and graduated with that from St. John Fisher in May of 2025. I've worked at Messina Hospital pretty much my entire career since 2008. I've done a little bit of everything, med surge, 10 years of labor and delivery. I've worked in the operating room, and the last 4 years I've been a primary nurse in the emergency room. I feel like I've kind of always been drawn to it. My mom is a nurse. She works in the operating room at Messina. Still, she has been there for almost 40 years. And I just feel like I've always been drawn towards helping people, and that's just where it led me. That's where it led me. I really am down to earth. I try and make sure that the patient has a say in their medical care. I can make suggestions, but ultimately you guide your care. I'm just here to drive the boat. You're the navigational person. So far, I have had great experience here at Community Health Center of the North Country. I have amazing colleagues who have supported me 100%, and all of the patients I've met so far have been extremely great. I did live in Tennessee for 3 years. I came back before I got my my FNP, but working in the ER, you see a lot of patients who just don't have primary care or just don't have any care, and that really did drive me to want to just be able to help more people, because there is a lack of primary care in our area. There's a lack of specialties in our area, but if I can take a little chip and a little bit of pressure off some of my other providers and colleagues, then great. And if I can help a few more people, that's even better. I am currently accepting patients all the way from newborns up. I will see just about anybody. They just are the sweetest, and they will say just about anything you can imagine, and that's just the funnest part of it. Well, just starting out, I find it challenging just to know the right direction without messing it all up. I feel that it's hard to just take over where somebody else has started the process. I feel like so taking over new patients that have been previously seen by my colleagues is just a little challenging, because you have to get to know the patient, you have to get to know their history, and that so far has been the most challenging thing. Well, I truly didn't know anything about the health centers, and during my clinical rotations, Dr. Desai, we were talking about what my future plans were, and he's recommended that I reach out to Mr. Bender and start and apply for this position here, because he thought that I would be a good fit for the community health center. Emily, outside the clinical environment, has 2 children, 15 and 13, a boy and a girl, who keep me very busy with all of their school activities and sporting events. So I will be out and about in the public and very visible. I have always said my true passion was women's health, labor and delivery. I feel that there is a lack of that in the North Country, and I am still continuing to grow my skill set in that area, such as like placing IUDs and offering different types of birth control and stuff like that. Honesty. I expect honesty. I expect you, I mean, I may not like the truth, but I will always listen to it and take it with respect, because that is at least what you're giving me by being honest. I like patients to show up and just engage in your healthcare, engage with me and make the plan what you want it to be, or what we want it to be, so that you can optimize your health.